Thank you. Thank you, Dr. Bourgeois and Lisa. And thank you, everybody, for allowing us the opportunity to share some information on this new program. So for today, we're just going to take a peek at the background, where the program stemmed from, what the program entails, including some of its goals, the pillars of the program model, and the program phases, and also a little bit about the eligibility criteria for families, and some of the gaps and barriers that we're seeing when serving and supporting the families. So I welcome any questions as we're going along, and also at the end there'll definitely be time for opportunity to have some dialogue around it. So just a little bit of the background. The program really grew out of parents reporting social isolation, mental health issues including anxiety, depression, and PTSD, health issues related to the impact of chronic stress, burnout, loss of employment, financial stressors, as I'm sure all of you are well aware, and this isn't any new information. Also parents not feeling recognized or supported as caregivers, or having difficulty being heard as experts on part of the team. Just a little bit of background, we did a small sample from our current complex care population, and this data was used to articulate the need for the Navigator program. So some information was collected on the social determinants of health of some of our existing families. And so one of the visuals that's not on here is that close to 50% of both fathers and mothers have a university degree. And as you can see on the left, for fathers, there's 11% unemployment rate. For the mothers, there's close to a 47% unemployment rate. And then the chart on the right is the annual household income. To note, this is before taxes. And there's approximately, the number that stands out is close to 40%, or just under 40% is below $50,000 annually, and this is before taxes. So in looking at the literature, the total economic cost to Canadian families of children with disabilities ranges from $20,000 to $60,000 per year, averaging $30,000 approximately. And as we all are well aware, that parents of children with medical complexities experience negative impact on the economic, psychosocial, and social well-being. And oftentimes, communities and health systems are unable to provide the resources for these children and their families. So new models of care are required to address social needs, the health of family members, for children with complex or medical complexities. So the Navigator program is a 5-year federally funded program through Employment and Social Development Canada, and it's intended to help address this gap in supports for parents of children with medical complexities. So provides expert resources, dedicated expert resources targeting the non-medical support mechanisms that address the social, emotional, and economic impact of caring for a child with medical complexities. So we often describe ourselves or consider ourselves the sister program to the complex care program here at CHEO, addressing the psychosocial or the social impact. So, and in addition to that, it also aims to uncover gaps in the system and identify solutions to issues that families commonly face, and as well as increase community capacity and awareness around these issues. So some of the goals here are to promote the social and emotional health of families, to help families access and navigate key supports and services, to increase understanding of the best ways to support families, and to find gaps in the system and solutions to problems that families often face. So the program really is twofold. So while we are supporting and assisting families one-on-one, we very much have a strategy on how to try and improve the systems that support these families. So, so our work is twofold. So the program consists of 3 pillars. that make up the support. So I'll let Teresa speak to the parent navigator role, and she can provide some description or insight on what that is.
Hi there. So I'm a parent navigator, which means that I have a daughter who has who's considered to be medically fragile and technologically dependent. So we offer peer-to-peer support to our families in the areas of daily living, social support networks, and that means how to cultivate their own support network and what that means and what that looks like. I know my daughter is almost 16, so I had to do this on my own before the internet. And it makes it easier now with Facebook groups and that sort of thing, and people are it's easier to connect, but there's a lot of social isolation. So we work to help parents cultivate their own support network by giving them opportunities to activities that we do in the community, but also, we can become part of their social support network as well. We help parents look for recreation programs in the community for their little people with special needs, or even for siblings, or even for the moms and dads themselves. If mom and dad are looking for a program, we can help them out by directing them. And sometimes that's all a parent needs. Sometimes they just need 1 or 2 steps taken out of their day and to look for an activity. And if we can help do one of those steps for the parents, it just kind of makes it a bit easier for the families.
It's difficult. Oh, sorry. We'll try getting closer to see. We just commenting that it's hard to hear, so let us know if this is any better.
We also can help families if parents are having a difficult time trying to organize their supplies at home, or to help them with all of the acronyms. We have this who to call kind of sheet that we can help parents streamline who they need to talk to and who they need to call if there's certain things that they need to help with their child. We also promote parent health and well-being. We do sip and chats. I know I'll get into that a little bit later. But we've had massage ladies come out to give chair massages to the families, and we just let people know that we have support for them.
Are we good with volume? We okay to continue?
I think it's okay. What I'm going to ask is that for everybody listening online, if you could mute your line so that there's no other background noise, that would be helpful as well. Thanks.
Perfect. Okay. So in terms of system navigators, what we really offer is support for the families as well to navigate needed resources. So it's myself as a system navigator, but we also have a social worker, so system navigator, social worker, who can offer and provide psychosocial supports and emotional support to the family, but also just in terms of navigating some challenging issues. So I often provide examples to put into context some of the barriers. One example is a family living in social housing who has mold in the building and is in need of some support in terms of advocacy towards the landlord because the mold has adverse effects on their child. So the family themselves wasn't able to, didn't have any success with the landlord, and as a team we supported that family and took on the advocacy piece in order for their needs to be heard. So that's just an example that I like to share. And I can provide more if anybody would like. And then the third pillar is the knowledge navigation. So again, this speaks to not only the one-on-one support, but gathering information to develop more effective tools and strategies to support this unique group of families. So learning from the parents and caregivers about their needs and where there are gaps in the support. So improving understanding, identifying gaps, finding solution, building community capacity to be able to address these, and as well as establishing best practice guidelines. So So this is our model. This was first drafted as a group, the Navigator team here, with support from the parent navigators. So there are 2 of them. And we have regular consultations with our families. So this program grew from the need expressed from families and has grown and been shaped by the families that we serve. So this particular one, we had a group of system savvy or veteran families that provided us input on what are external communications, how to reach families, and how to really brand and market ourselves. So this is one of the things that they helped us with, was this program model. So family-centered. If we start at the beginning, the little circles around the yellow with the people is really their community, and their community often revolves around the support of their child. So seeking information, future planning, finances, relationship health. You know, the community is really rooted in caring for their child. So the green bubbles are what the Navigator program can offer, or has offered to date. So the one-on-one navigation support, peer support, advocacy, etc. And the arrows are a representation of us, the two-way relationship of really working collaboratively with families to shape the program so that it suits their needs, and then also us working with the families to help support them. And I think it's important to note that the way that we work with families is really client-centered, and so in terms of meeting with the family, it's them that identifies what their goals are, what their needs are, what they would like to work on, and really how much support they require from us. So it's quite collaborative, the work that we do. So we have just wrapped up year 1, which was we call it a pilot phase, but it was really a learning and development year for the program. So 30 of the families. We served 30 families in the first year, and they were selected from the Champlain Complex Care Program here at CHEO. And the purpose of that was that we knew that their medical care was coordinated. So in working to try and support the families or the parent in their caregiver role, we could really focus on that. We've had some learning since year 1. I think one of them is that in year 1 for those 30 families, we were doing intakes or meetings with the families, and we were meeting with one system navigator and one parent navigator. And the thought behind that was to, we often hear families say that, telling their story, repeating their story, that they have to do that quite frequently. So to avoid the duplication, that we would go in as a team and then decide from there, or have them decide which route, if they needed peer support, if they wanted the social aspect, if it was more system navigation. And one of the biggest learnings was that was probably not the smartest thing to do. So we actually received feedback from families saying that we were CHEOizing the peers or professionalizing the peers, and in doing so there was actually creating a wedge between the families and this peer role, because as one mom says, we already have enough professionals in our lives, we just want a peer. So that was a really big learning for us. So in terms of year 2, what that looks like is when we now meet families, we offer various streams, and we ask that the families kind of identify ahead of time, and we work with them to do a little bit of a screening to, is it the one-on-one system navigation, or is it really the isolation and connecting with a larger community of families? And of our initial families that we started to take in year 2, quite a few of them were just interested in the workshop information and groups, and so I can explain a little bit further what those streams are, but that was one of the big learnings for year 1. So here's our eligibility criteria for anybody who is who's curious. So the parent or a caregiver of a medically complex or fragile teen under the age of 18 who is currently receiving services from CHEO. And your child or teen must have at least one of the following: multiple medical issues, and or multiple specialty teams involved in care, and a chronic condition that requires ongoing, frequent, or time-consuming medical interventions, including 24-hour management of care. So this is another area where we worked really hard with that veteran group or the system-savvy families to ensure that we were, our language, that families could see themselves in the language that we were using. So they worked with us to kind of help revise so that there were some tangibles that families could look on our website and go, oh yes, I would like support in this area. So we specified it so that families could kind of have an idea of what some of the support is that we could offer. So seeking support in one of the following areas: so achieving employment or education goals, improving knowledge and access to key supports, expanding your social support networks, strengthening relationship health, coping with stress, creating self-care techniques. All of those are with our the social worker on the team. Finding accessible recreation, connecting to peer support, and just managing the day-to-day issues. Okay, I'm almost done. I've got a few more slides, and then we can open it up for questions. So program supports. So this is the various streams that I was talking about. So we're pretty transparent with families. Actually, on the application form, we ask that they identify what types of information they're looking for or service. So, and just to note, we, in terms of referrals, the referrals are actually, they can be self-referrals, so it's on our website, and families can self-refer to the program. If it is a physician or community partner that's doing the referral, it has to be with the consent of the families or of the parents. So again, that's with the spirit of having the parent be the one driving and identifying what their goals are. So in terms of supports, there's the one-on-one peer support. So that would be our parent navigators would connect. We've had a little bit of this happening. What it often looks like is that the parents are connecting with other peers because they themselves would like to give back. So we've had parents who felt that they were stable and were in a position where they wanted to support other families. So they would connect with their parent navigators to talk about delivering a workshop or offering some supports that they felt that they could to other families. So one-on-one system navigation support, I think I spoke to that a little bit earlier. Parent therapeutic support group. Social gatherings, so that's the sip and chat, and those are, we have them 4 times a month. And in the community. Workshops, those have been paired up most recently with the social gatherings, but some examples of workshops, Teresa, if you could.
We did one on RDSPs and how to make it feasible for families to be able to access that program. In the new year we have ODSP coming out, Ontario Disability Service Program, and they're going to come out and chat with our families just to show them, you know, beyond what's next for their children as they're transitioning. We have someone from the March of Dimes coming out to chat. We also had one of our moms. She did a workshop on creating an accessible house that she had built for her daughter, and we had quite a few participants come out to listen to that one. She did a great job. And we also have a woman coming out to do laughter yoga with our families. We thought that sounded like a really great idea. So we look forward to that one.
Yeah, and these are all parents or caregivers that are requesting information on these topics. So, and then the outreach and community education, which again, as I mentioned, is a key part of this program aside from serving the families one-on-one. Gaps and barriers to date. So as one of the deliverables to Employment and Social Development Canada is to really get a pulse on what some of the challenges are that the families are facing in order to address them, to raise awareness and to address them. So again, I don't think any of this will be a surprise for you guys. This document actually is a 20-page document plus and growing, but just some of the highlights. Financial burden and navigating financial assistance is at the top. So that's the one in terms of system navigation that we most frequently address, and that, you know, in terms of filling out forms, in terms of making sense of what funding comes from where and how to optimize. Isolation and developing social network, and these are in order. Those two are at the top because they're the most frequent issues that we're addressing. Respite. So finding, training, and retaining a reliable worker for home support. Daycare, securing daycare, and also the funding required to support the appropriate staff to fulfill medical requirements. School, ensuring appropriate staffing and designated support. Recreation. This is for the whole family. We do quite a lot of stuff in terms of connecting siblings to pro-social activities, and as well as parents themselves so that they have a healthy outlet. And then the emotional health. I think this is kind of an overarching, you know, the grief, anxiety, depression, marital health. Okay, and I think this is our last one. It's just to highlight some of the after year one where we are and what some of the accomplishments are. So I think Teresa, if you want to speak to the family day.
Sure. We had a family day back in May. We had invited all the families, and we had rented a hall in the community, an accessible hall, and we had a musician, we had crafts, we had prizes, we had snack, just a small snack. We didn't want to make it a big thing about food, but we had a little bit of a snack. We had activities for the children, we had a photo booth, and we just wanted to make it a really lovely, all-inclusive, fun day where families could come and get together and connect with other families who they may have met online through Facebook groups or support groups, but they hadn't got a chance to meet in person. And I think that's what we heard from that day, that it was just a fun day where parents could connect in a safe environment. And by safe, I think I mean where it was, everybody was inclusive. Everybody gets it, and you know, it was a really happy, fun day, and I think it was reviewed by everyone really, really well, and it was so much fun to organize that.
And I just want to clarify that, so it was extended to, this was early on in the program for us, so it was extended to all of the families from the CHEO's Complex Care Program. So we had a total of about 44 people show up, which was wonderful, and I think also we had time and workers donated from service coordination, citizen advocacy, students. And it was a big marker for the program because, again, if we go back to the gaps and barriers, the isolation was something that was really high up there. So in terms of being able to offer the family something immediate, it was that connection with others. So yeah, so I think that was, and then the peer-to-peer and families contributing to the program was just highlighting that families do want to contribute to the program and have, you know, they're the experts in their lives and in what's going on, and it's just astounding when we reach out to offer support that a significant number, a noteworthy number said, you know, I don't need the support because I feel like we're stable, but I want to give back to others. So creating the space for families to do that in the form of workshops, in the form of coming out to sip and chats, you know, connecting at Family Day, and also providing feedback into the development of this program so that it resonates with them. So the social work community of practice is something that we have created. So At CHEO, there are social workers at CHEO, social worker for the Navigator Program, at the Ottawa Children's Treatment Center, and other partner organizations that we bring together quarterly to share information and to strategize on how to support these families and raise awareness around some of these issues. So the conversations are not just happening at CHEO, they're happening across the board to have a longer lasting impact. So as part of that community of practice, we hosted a 2-day PTSD training that was offered by the Crisis and Trauma Institute. And so included in that were the social workers, but also the nurses from complex care and various partner organizations, again, to raise awareness and to strategize on how we can best support these families. So in terms of resources and tangibles, we're working with CAFC, with our Knowledge Exchange Network, to house resources that are local, so specific for families to use for employers, for etc., so that there's this database of resources. But this is also where we will house the best practices as we learn and as we grow. So there will be a therapeutic support group on trauma starting in February. And then the other thing that was quite exciting is we're working with a creative writer to kind of raise awareness and do some gentle advocacy around some of the findings that we're uncovering. And so one of these was, it's hosted on a Medium blog, and one of them was an article on trauma and how parents of medically fragile children suffer trauma. And it's only been posted for December 14th, and we've had over 6,000 views at this point. So obviously it's a topic that that strikes a chord with many families and with many people out there. So I've attached the link so that you guys can go and read if you'd like. And I think that's it. Sorry for taking a little bit longer.
Oh, that's terrific. Thank you so much. It's Kristen. So thank you for that wonderful presentation and for taking the time to share the work that you're doing. It's really robust and such a collaborative program with families. It was just really great to hear about this program, but I just want to open it up to questions. Does anyone have any questions for the group? And just unmute yourselves and feel free to go ahead.
This is Lisa. I'm just wondering a little bit more about the funding process, how you approached the federal government. I can't remember the department, but
yeah,
that worked.
Employment and Social Development Canada, and it was actually an unsolicited funding proposal. So there was no call for proposals. It was just the need was evident, and the team put together this proposal with the work from Dr. Majal, families, you know, again, a collaborative effort, and submitted this proposal.
This is Lisa. Thanks very much for that answer. People are asking about sharing the presentation. So this is being recorded, and the recording will be up on our Knowledge Exchange Network, and I'll share that link with everybody
Okay.
following, just so everybody knows.
Okay. Is it possible for me to ask a question while I have so many people's attention? Just in terms of building the resources for, you know, the local resources, but also the resources for best practice that we'll be sharing on the Knowledge Exchange Network. What would be most useful in terms of information or knowledge to support the work that you do? No taker. I could also, I don't know if there are minutes or if anything goes out after, but I could maybe send the question to you, Lisa, and see if anybody is able to respond after the fact.
Sure, that would be great. I think that you've given people a lot to think about here. So.
Yeah, well, and hopefully this is a dialogue as well, and I'd love to share as, you know, as we grow. I'm sure there'll be more learnings, and, you know, hopefully this is just the first of many conversations. So.
Good afternoon. This is Maria.
Hi, I'm Maria.
So I'm calling in from Manitoba, or listening in actually from Manitoba, from Winnipeg, and I was just curious a little bit about the navigator role. Do you have any community partners that are also navigating with the families sort of in their lived experience in community, or is the navigator a hospital-based kind of role?
So it's funny that, so I failed to say that, but so our team is a team of 4, so 2 system navigators and 2 parent navigators, and the program is actually offered in partnership with Pinecrest Queensway Community Health Center, and our parent navigators are housed out of this community health center, and the main reason, I think, is to kind of decentralize the support and the service that is offered to the family so that it's not central to CHEO, and that they're also in a venue where they can be easily connected to other community resources. So I know that's not a direct answer, but and the other part is, yes, we are working definitely collaboratively with community partners to be able to provide the support, but not any other navigators per se.
Oh, I appreciate that. Thank you.
Yeah, no problem.
I have a question. It's Mary Ellen from Ontario Provincial Council for Maternal Child Health. I'm sorry if I missed this point. Is there any sort of formal evaluation? And I'm thinking in terms of, you mentioned that was 5-year funding.
Yes.
Is there any sort of evaluations that would support some ongoing commitment to this program after that 5 years?
Yes. We have quite an extensive evaluation framework. It's funny, I contemplated whether or not to include it in the presentation or not, because it's quite it is quite comprehensive. So I'd be happy to share what that is. If you would like me to send it by email, but yes, there is. Yes, it might be a little bit too lengthy to give you a summary right now.
I would be very interested and appreciate it. I'd also, since there's a formal evaluation of the provincial CCKO
Yes.
Work, would I be free to also then share it with the researchers doing our work, just to see where there's some synergies or overlap?
Yeah, I don't see a problem in that. I can get your contact information and follow up directly with you.
Thank you very much.
Okay.
And this is Chantal Krantz, and I'm also have seen the CCKO evaluation, comprehensive evaluation, and so there's not a whole lot of overlap because, again, we're trying to address some of the deliverables that we're accountable to for Employment and Social Development Canada. So the only piece, I guess, that would be similar is the sort of the parents, you know, there's very similar but not quite the same in terms of the parents' effect on parents' health. But we're not using a specific tool like the CCKO is using.
Thank you. Chantal, would it maybe still be interesting to share with the investigators?
Oh, absolutely, absolutely.
Thank you.
Any more questions?
So how do you envision to ensure sustainability? If there's no funding in the end, this will have been quite incredible impact for families locally to have that, you know, peer support, networking, and navigation. And any thoughts on how to integrate this in the system?
Yeah. So we're doing a lot of work early on to kind of ensure, you know, if we look at the community of practice of social workers, for example, you know, I mentioned that the 3 pillars, you know, 2 of them are directly for serving families, but the other one is really to focus on the strategies on how to improve the systems that support the families. So by creating these, the community of practice, by raising awareness and trying to address some of the gaps that we are facing. And the other component in terms of the peer support is really creating a parent-led, not necessarily organization, but you know, the community of peers that will also be that will also last. So, Chantal, do you want to add anything on to that? I don't know if you're still.
Can you hear me?
Yeah, yeah.
Okay, I never know if I'm on mute or not. Yeah, no, exactly. I think the community of practice is really looking at working together to create best practices. But, you know, our vision down the road is really to build what we're learning that others can learn from on the KEN, on the Knowledge Exchange Network, and also look at, you know, perhaps a community of practice that's both the social workers' expertise in all organizations, as well as across Canada, and parents who are very system savvy and are and have great solutions on how to address and have addressed some of these issues. So, I mean, right now we are working with CAPC, just creating a local resource. This may not actually be helpful to people across Canada, but what will come on there will be, and we're hoping that by building that and creating a group of like-minded people that want to solve some of these complex psychosocial issues and financial issues that families are facing with employers or barriers that they're encountering through the government, that will in itself be sustainable, because people will continue to build on that. I hope that answers.
This is Lisa. I'm just wondering, so in the Champlain program, so you have someone who sort of coordinates all the medical, and then this Navigator program is a more psychosocial thing. So do those 2 people connect, or those 2 programs connect?
That's a great question. Yes, we definitely connect with intent, with purpose. So we meet weekly, and that again was a learning after year 1. Is we were doing weekly case review. So with the 2 nurse coordinators, the parent navigators and the system navigators, to have conversations about the same families, the families that are overlapping, that we're working with, so that we can kind of support them in a holistic way. Mm-hmm. We found that probably wasn't the best method to do that. So what we've done now rolling to year 2 is to join, so the system navigators will be joining the complex care team weekly, once a week, for their rounds specific just to the families that we have overlap with. So, and then there are discussions about how to do that, you know, whether or not the system navigators or the Navigator program should be a part of the medical visits when they do come. Not a part as in, you know, in clinic, but having office hours during that time, so that we're accessible that way. Or so I anticipate there'll be some learnings on and best practice around that, but moving forward. And then the other thing is that we're participating in family-focused team meetings, transition meetings. So yes, there's a lot of work that we do together to support the families.
Great, thanks.
Mm-hmm.
This is Lisa again. I'm just going to ask Natalie, because you're on the medical side of this. So are you hearing from your side any differences? Or, and again, I know it's early on in the program and the changes. Do your families talk about this? Or?
Yes, with great excitement, the family do talk about it. I think the common of what we hear from families is the ability to connect with other families and having that peer support that has been such, I would say, groundbreaking area for the family. So commonly I hear families that they're feeling so lonely, isolated, people not understanding what they're going through. So that definitely I've heard on a number of times. In terms of having access to a navigator in the community and the social support, that too for us is really of a great change, because we have attempted to integrate the existing social worker that are connected to some of the specialty or other organizations to look after these patients. And the challenge is that when the psychosocial umbrella need of these families is so great and goes so far beyond what sometimes some of the social workers have time to do. So, for example, if you have a cardiology patient that is intense in requiring cardiac surgery, the cardiac team has a social worker that will help and facilitate, mainly in the areas of supporting the family, making sure they're financially able to do the travel, to make sure that employment is covered or the forms are covered. But there's the whole layer of there's multiple conditions as well, and it's chronic, it's ongoing. When the child had the cardiac surgery and comes back, there's other issues that arise, and the social worker don't have time to follow up and to anticipate and to further discuss, because they continue to have new referrals to the cardiology team. So having this different layer and approach from a social worker area, availability has also been great.
Great, thanks, Natalie.
It's Karen from North York General. I was wondering if you guys had families with limited English proficiency.
Yes, we do.
Okay, and so did you guys find that the CHC helped you with interpreter services, or did you guys tend to use face-to-face interpreters or more phone, or how did you manage ensuring the families could understand all their information?
Yeah. So as I said, that they had limited English proficiency, but not to the extent that there was a translator required. So what we do is the majority of the meetings are in person, face-to-face, with intent to ensure clear communication. And a lot of those challenges, they obviously facing with other partners as well, in terms of completing paperwork or in terms of completing. So our services were really to support them in that capacity. But I know that both the CHCs and CHEO have translation services. So I'm not too sure which route we would go, but yes.
Thank you.
Okay, great. Excellent question.
I just wanted to add something, if that's okay. It's Teresa. I'm with here at Navigator. I just wanted to add, I think, for my role, it's been such an exciting position to be in, because, like I said, I'm almost 16 years in to being a mom of a medically fragile child, and some days I'm better able to cope, but I think because I've been on the path for so long, for me to be able to help other families, and because I know how isolating it is, I know how fearful it is, and how scary it is, and I think that just for another family, just to be able to hear someone say that they get it, I think that's going to make such a huge difference for the families. I know I can remember even little things back when my daughter was a baby, just when someone would say that they get it. And, if I'm up all night with alarms from a ventilator and I'm exhausted, and I have a friend who says, oh yes, I was up with the baby all night, and I get it, and they so don't get it. But when you have someone who knows what that's like and know how exhausted it is and how scary it is and how this life is so fluid, it can change in a heartbeat. One moment you think you've got it and you're doing well and you're stable, and then a minute later you're not. And I think that's what makes this program so wonderful, is that we're able to give that to families. We're able to say, we do get it, and we are listening. And I just think that that's just a wonderful property of this program. And like Breanna has said, we've had so many other moms and dads who want to help. And I think that that's our innate nature, is to help people. And I think when you see, when you see another family suffering and you see it reflected in their eyes and you know what that's like, to be able to say that we hear you and we understand, I think that's going to have such a value and impact for our families.
Thanks very much, Teresa. So, Kristen, if you want to...
Yeah, well, I think, yeah, that's great. Thank you for those final comments, Teresa. I think it's very well said. So at this point, looking at the time, so we'll wrap up question and answer. Again, thank you for that terrific presentation from all of you. I think it's evidence that everyone really learned from your presentation and is, I think, eager to see your continued outcomes and success with the program.